Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined today by the Acting Mayor of the City of London, Josh Morgan, the Associate Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers, and the Chief Medical Officer at London Health Sciences Centre, Dr. Adam Dukelow. Happy to be joined this afternoon as well by members of the local media who are in attendance. Thank you for joining us once again. If you would like to ask a question of any of our guests today, just click on the text bubble with the question mark here on Microsoft Teams. And when you do that, if you could indicate your name as well as your media outlet and who your question is for. And finally, a welcome this afternoon to those folks who are joining us on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio 980 CFPL, and those who are joining us today on the CTV London website. Let's get to the opening remarks right away, and we'll start with Acting Mayor Josh Morgan.
Well, thanks, Dan, and good afternoon, everybody. It seems with each passing day, there are more groups, organizations, and businesses implementing their own vaccine mandates. I know Mayor Holder mentioned last week that discussions between the city manager and our labor partners were underway for City of London employees, and I do have an update on those discussions to share this afternoon. After further review and consultation with the local health unit and union leadership, staff are currently working on a report focused on a vaccination policy for the City of London employees. This will come forward on the added agenda for the August 30th meeting of the Corporate Services Committee. As this report is still being prepared, I am not in a position to share details of the policy, what it might look like, to whom it might apply, or when it might come into effect. Again, all of this will be made public on Friday. To think back when masks first became a public health issue, we take the wearing of masks for granted now. But last summer, we started seeing masks being required at most, if not all, indoor establishments. At first, it was a few places here and there, but then within weeks, it was mandatory everywhere. And the same appears to be happening 12 months later with vaccines. No one is forcing anyone to get the shot, but with case counts rising dramatically as they have, now is the time to do absolutely all we can to encourage people to get vaccinated and provide even greater protection to those who are vulnerable, especially kids under the age of 12, those who are immunocompromised, and those who can't receive a vaccine for legitimate medical reasons. Please, if you haven't been vaccinated already, get the shot today. Since July 12th, 87% of all COVID cases in London Middlesex involve those who did not have 2 shots. Well, the same is true for about 95% of all of our hospitalizations. That's it for me. Over to you, Dr. Summers.
Thank you, Deputy Mayor, and good afternoon. I bring, as always, greetings from Dr. Mackey in his absence. The 4th wave has definitively arrived in the Middlesex-London region and in Ontario. Case counts are rising rapidly. Over the last 3 days, the MLHU has reported over 30 cases, nearly 50 reported on Saturday, 30 yesterday, and 30 cases reported today. Our incident rate over the last week has risen to 40 cases per 100,000. This is an incident rate of COVID-19 that is consistent with what was previously called the red zone at the provincial level. Regardless of what zone it falls in, however, it is indicative of a rapidly rising number of COVID cases in our community. As the Deputy Mayor stated, since July 12th, only 14% of those cases have been amongst those who are fully vaccinated. The remainder have been amongst those who are unvaccinated or partially vaccinated. That ratio gets even more dramatic when we look at who has been hospitalized, and we've had no deaths amongst those that have been fully vaccinated. It is critical that vaccination is the #1 priority for all in our community, not just for yourself, but for those around you. We have seen substantial outbreaks amongst nightclubs and bars in the downtown core of London. The Delilah's outbreak is now up to 26 primary cases, with 1 new case reported over the weekend. The outbreak at Lost Love is at 14 cases, with 4 new cases, reported over the weekend. High-risk activities clearly include close contacts amongst groups, particularly when people are unvaccinated. The mixing of unvaccinated and vaccinated individuals will result in transmission even to those that are fully vaccinated. The good news is that if you're fully vaccinated, you're much less likely to get infected. And if you are, you're substantially less likely to be hospitalized or to die from the illness. You are also substantially less likely, it appears, to be infectious and for a shorter duration. Studies are still ongoing in that area, but early results are encouraging. As I mentioned, nightclubs and bars remain higher risk activities, and I would strongly discourage anybody who's unvaccinated from attending one of those events. We are also seeing transmission amongst sports teams, with pockets of transmission amongst basketball and soccer teams, as well as a large outbreak amongst hockey camp. Again, activities where close contact is occurring, particularly if there's unvaccinated individuals, is concerning, and that's where we are seeing transmission. We will continue to work with all higher risk premises and higher risk activities to ensure that what can be done is being done. But I would highlight that as we head into the fall with the rising transmission of Delta and increasing case numbers throughout our jurisdiction, that these activities are higher risk and may have to be avoided. What else can we do? We've gone through 3 waves. We are now in a 4th. I want to emphasize critically that getting vaccinated is the single most important thing that you can do for yourself, your family, and for those around you, and particularly for those in our community under the age of 12 who cannot at this time get vaccinated. Our mobile clinics continue to operate in our jurisdiction. Over the weekend, we partnered with Pride London to provide vaccines at the Palisade, delivering 68 doses, and over 40% of those were first doses. Our doses till dark interventions and activities on Richmond Row on Friday and Saturday nights resulted in 107 people receiving vaccine, and 45% of those first doses. The mass vaccination clinics continue to be available for walk-in appointments. For employers, I strongly encourage you and recommend that you consider mandatory vaccination policies for any in-person activity, particularly if you have groups of people gathering in close proximity. A proof of negative test is not likely sufficient. Mandatory vaccination is what will ensure that those who are in close group activities who can be vaccinated are vaccinated. And it is the best thing that we can do for our employees, workplaces, and all activities in which in-person gatherings are occurring. Make sure those around you are vaccinated. Vaccinated people, as I mentioned, are much less likely to get sick, much less likely to get infected, and early studies are suggesting less likely, if infected, to transmit the virus. The Pfizer vaccine in the United States just got full FDA approval. Any reason to not pursue vaccine at this point is diminishing, and I strongly encourage, as this 4th wave is upon us, to get out and get vaccinated. I'm going to pass things over to Dr. Dukelow shortly, and I would highlight one of the reasons to get vaccinated is to ensure that our hospital system remains operational. Modeling is suggesting that the burden of illness from the 4th wave will be highly impactful on our healthcare system, and so we look to our community to help out our healthcare heroes, our frontline workers like Dr. Dukelow, in ensuring that our hospital system remains robust and protected. Over to you, Dr. Dukelow.
Thank you, Dan, Deputy Mayor Morgan, and Dr. Summers. It's a pleasure to be here this afternoon, and I'm grateful to be included in this opportunity to chat with our community and our press colleagues. As of this morning, we're caring for 8 COVID-19 positive inpatients, less than 5 of which are in critical care. You'll note that that number is just slightly higher than it was last week, but it is on the rise. We also know that hospitalizations lag behind case rates by at least 1 to 2 weeks. So I anticipate our in-hospital numbers will continue to climb in the coming days and weeks, unfortunately. I want to address last week's provincial announcement about mandatory attestation of vaccination status and testing for those that are not vaccinated. It provided a welcomed policy standard for all of Ontario's hospitals, including us, to follow. We are in the process of working through an implementation plan for the pieces we do not already have in place to ensure we are aligned by the September 7th deadline. Staff members and physicians at LHSC have already been required to attest. We launched that in early July, and we're coming to the completion of the attestation process. The attestation is being done through an electronic education program. Approximately 85% of our staff have completed their attestation. 93% of those have reported being vaccinated. With the move to mandatory proof or regular testing model, we will work to close the gap between attestation and submission of proof to validate that value. We are aiming for 100% of our staff and affiliates to have completed their attestation by early next week. We recognize that other centers, hospitals, and other healthcare sectors and non-healthcare sectors have announced even stricter policy. At this time, we are still focused on the provincially directed proof of vaccination or proof and attestation, as well as regular testing as the next step forward. We will know our true vaccination rates by early next week once the mandatory attestation is complete. And at that point in time, we will make our policy decisions based on if we go above and beyond the provincial standard. We've always maintained our focus on ensuring safety for everyone working, learning, and receiving care at London Health Sciences Centre. And this latest direction is another step we're taking in that ongoing commitment. Thank you for attending today, and I look forward to your questions.
Thank you very much, Dr. Dukelow, Dr. Summers, and Acting Mayor Morgan. All right, well, we do have a lot of questions in the queue, so let's get to those right away. The first few come from Jennifer Beeman at the London Free Press. Dr. Summers, the first one is for you, and you did mention the additional cases associated with Lost Love and Delilah's and the outbreaks at both those locations. Jennifer would like to know, what is the vaccination status of the 109 new cases reported since Friday? And then to the other point, are any linked to the Lost Love or Delilah's outbreaks?
Thanks, Jen, and great questions. I think I've highlighted most of those. We don't have the vaccination status breakdown for just those 109 cases. What we do know is that since July 12th, 14% have been fully vaccinated, the remainder partially vaccinated or unvaccinated. We do update that data daily on our website, Monday to Friday, that is, but we don't have specifically the 109 cases since the weekend. What I will highlight is that it really is being borne out through predominantly an unvaccinated population. One of the things that keeps coming up is that when you have everybody who's vaccinated, you may get one or two cases, but it won't spread. And we saw that with our most recent retirement home outbreak, which most certainly involved the Delta strain. And what happened in that instance is there was likely somebody who was infected by a community member who would have been unvaccinated. But once that person returned to their home in the retirement home, it didn't go much farther because everybody was vaccinated. The key thing is, if we get our vaccination rates up to that goal of north of 95%, approaching 100 amongst those who are eligible, we can actually start to take advantage of that herd immunity and prevent transmission even amongst those who are vaccinated. With regards to the Lost Love and Delilah's outbreak, as I mentioned, one new case associated with Delilah's, bringing the primary case total to 24, 4 new cases identified with Lost Love, bringing the total to 14.
Thank you very much, Dr. Summers. A follow-up question for you from Jennifer Beeman. How big of a threat is this case surge to fully vaccinated Londoners? What is your advice for these people? Do they need to be worried like they may have been in the second or third waves of the pandemic?
The risk to fully vaccinated individuals is substantially lower than the risk amongst those who are unvaccinated. You have a lower risk of getting infected. The protection that is provided to you by the vaccine is substantial. Estimates range across the globe, but are certainly north of 50%, if not substantially higher here in Canada, given most recent observations, potentially north of 80%. Critically, though, even if you are infected, your probability of having symptoms, and certainly severe symptoms that require hospitalization or leading to death, drop dramatically. Your risk is notably better. The key thing right now with the Delta strain is that because it's so infectious, it will start to tear through populations of unvaccinated individuals. So for those who are vaccinated, the way to continue to protect yourselves is to make sure that those around you are vaccinated, and work with the places that you attend to make sure that they are also expecting people to be vaccinated in those settings as well. In that way, we create that herd immunity, and we are able to protect one another by making sure we're all vaccinated.
Thank you very much, Dr. Summers. And let's go to our next question. And again, this is another one for you from Jen Beeman. Do you anticipate, given the way things are going right now during the fourth wave, a retightening of public health restrictions? Do you think that will be necessary if cases continue to rise in the coming weeks and months?
Thanks. That's a really important question, and one that I think is on front of mind for all of us. With our current vaccination rates, we will continue to see transmission and spiking of cases unless physical distancing is maximized. I would encourage people to consider reducing their social contacts as much as possible over the next number of weeks in order that we might avoid further public health restrictions. However, the vaccination rate is going to be certainly of great help to those who are vaccinated, but because the Delta strain is so infectious, we will likely continue to see a spike unless we see vaccination rates increase dramatically over the next couple of weeks, or if we see physical distancing maximized more than it currently is. I would strongly recommend that people continue to keep it outdoors, limit your social contact, and wear a mask if you're indoors at all in a public environment. We will certainly watch this closely. We certainly look to the province as well for guidance in this area. But again, the fourth wave is certainly upon us and cases are continuing to rise.
And we also know, Dr. Summers, that school will be back in session. And one more question from Jen on that topic. Rising case counts in the return to school last year put a run on testing capacity here and across Ontario. So the question is about testing. Are you expecting the same to happen this year? And with the Oak Ridge Assessment Center now closed, are you worried about long waits for tests?
Thanks for that question, Jen. As we've mentioned before, the assessment centers are operated and under the jurisdiction of Ontario Health, which is the health care provider. So MLHU does not oversee testing capacity. We will require additional testing capacity, however, as we head into the fall, and those conversations are certainly active. MLHU has outlined anticipated need for additional testing, and I know our healthcare sector partners have also highlighted that need. The assessment center at Carling Heights is increasing their internal capacity, which should greatly help as we return to school. We also have partners with My Health, which is increasing their testing capacity. We anticipate that the testing capacity in the region, even in the absence of Oak Ridge being up and running, will be similar to what it was last year. And hopefully that will ensure that we have enough testing capacity going into the fall. However, again, it highlights the importance of ensuring that early symptoms are identified and that testing is taken. And we hope that we do have that testing capacity in place.
Thank you very much, Dr. Summers. A couple of questions now for Dr. Dukelow. And these are again from Jennifer Beeman at the Free Press. Dr. Dukelow, do you have updated figures on the vaccination status of LHSC staff? I think you mentioned some of that off the top. What areas of hospital operations are seeing the lowest uptake? Patient-facing clinical staff, administrative, behind-the-scenes support staff? Where are those numbers the lowest?
Thanks very much, Dan, and thank you, Jen. So we've chatted before about how we're in a bit of a transition. We have two different ways to look at the numbers or to get the numbers in terms of our vaccination status. So traditionally, we've relied on occupational health data, which is a self-reporting and a private health record for the individual employee or physician. Those numbers say that our vaccination rate is about 71% for all staff and physicians. If we move forward to the more recent attestation process through the online education module that I mentioned earlier on in the discussion, we have about 85% of our staff have done the attestation and 93% of those are vaccinated. So the actual vaccination rate of our staff and physicians is probably somewhere in the middle. I'm optimistically saying 90-ish%, and we'll have a very good idea of that early next week. In terms of which staff groups have what vaccination rates, I haven't dove that deeply into the data yet, but once again, next week when the attestation phase is complete, we will know by unit and by program what the vaccination rates are.
Thank you very much. And a follow-up question for you, Dr. Dukelow, and this gets into some more of the details of LHSC's vaccine policy. Is LHSC considering adopting a policy similar to the university hospital networks, terminating employees who refuse to get the shots?
Thanks, Jen. It's a very popular question these days, both in discussions like this as well as in social discussions. What I will say is that we are considering everything we can in order to get our vaccination rates up absolutely high as possible to protect our patients and protect each other from this super contagious Delta variant. So we are in our attestation phase right now and considering the option of mandatory vaccination for all staff and affiliates at London Health Sciences Centre. And once we have that attestation phase complete, we will come up with our final policy that's due on September 7th.
Thank you very much. Let's go to our next question. It comes from Jacqueline LaBelle at Global News Radio 980 CFPL. Dr. Summers, this one is for you. There are currently COVID-19 cases associated with 6 day camps and 1 outbreak among those. Is the MLHU concerned about the sudden increase in cases? What do parents and guardians need to know about the risk of COVID-19 that is being spread at day camps?
Thanks for that question, Jacqueline. Yep. We are concerned about the rise in case counts in all sectors. And I think what is being seen in day camps is consistent with what is being seen across our community. The Delta strain is more infectious and is causing increasing transmission in all settings, particularly where we have unvaccinated individuals like those under the age of 12. For parents and guardians out there with kids under 12, my advice to you is to make sure that the adults in your children's life are vaccinated. Make sure that they're comfortable wearing a mask in an indoor environment. Make sure that, again, if there's any symptoms at all, that they are taken for testing as soon as possible. It is absolutely important as we approach the school year that we get kids back into the classroom. And I think one of the priorities for the health unit is to ensure that we create and work with those in our community to make sure we can get kids back to school. That may mean that some other activities outside of the classroom have to go on pause, and we'll monitor that with the province over time. But for parents, make sure every adult is vaccinated, make sure masks are being worn, and if symptoms develop, make sure everybody's tested as soon as possible. That's what you need to do right now, given the fact that we can't vaccinate kids under 12.
Thanks, Dr. Summers. And the next question is from Steve Young at CTV and News Talk 1290 CJBK. And actually, it comes, your comments move very well into this when you're talking about getting ready for the school year and activities there outside of the classroom. So Steve is asking, Windsor-Essex has canceled its high school football season due to COVID concerns. Where do things stand in London? Are you in consultation with the local school board about this?
Thanks for that question, Steve. Yes, we're in ongoing consultation with the school board about many, many things, including extracurricular activities. The provincial framework that came out for schools a few weeks ago did indicate that extracurriculars would resume this September. Even since that has been released, the Delta wave and the 4th wave has increased. And as a result, I think all reassessment of activities in school will need to be considered. Obviously, extracurricular activities are such an important part of a student's time in school and so important to children and youth of all ages. However, as mentioned, the priority has to be kids in the classroom. And so we'll continue to work with our school boards as well as evaluate where transmission is happening in order to determine how best to make the school year a success.
Thank you very much, Dr. Summers. And a follow-up from Steve Young. Dr. Summers, of those who are double vaccinated and are testing positive for COVID, do you know what vaccines they got? And if so, is there a combination of vaccines that has become a common denominator?
Thanks for that question, Steve. No, there's been no common theme at this point from our observations amongst the fully vaccinated cases that have become COVID cases. All of the vaccines have been highly effective and shown through many studies to be effective in preventing severe illness, hospitalization, and death, which at the end of the day is the real critical outcome that we're looking for. But we've certainly seen no specific trend. If you are fully vaccinated, please be reassured that you've done the right thing regardless of which vaccine you've gotten in order to protect yourself. And that includes those who got 2 doses of AstraZeneca, a mix of AstraZeneca, a mix of mRNA vaccine. No matter what combination you've gotten, whether or not it's that mix or not, when you've had 2 doses, you've really done what you need to do to protect yourself and those around you. Next up, make sure that those around you are vaccinated as well.
Thank you very much. Another question for you, Dr. Summers. This is from Sarah Javakhanji at CBC London. Dr. Summers, several mass vaccination clinics across the province are set to close and focus on more targeted vaccine approaches as first dose appointments wind down? Will London be closing any of its mass vaccination clinics soon?
Thanks for that question, Sarah. Yes, a similar strategy is unfolding in the Middlesex-London region. You have seen reduced hours at our Earl Nichols and North London site, as well as reduced hours most recently at the Mount Bridges or Caradoc site. Those reductions will continue to happen so that we can utilize those resources in other areas. By reducing hours, for example, at North London Optimist Centre and at Earl Nichols, we've been able to increase our mobile clinics like doses till dusk, pardon me. Dan, I can never get that name right. You'll correct me, I'm sure. Regardless, further reductions are going to be happening. Earl Nichols and Enlock will be closed after Labor Day, and Agriplex and Caradoc will continue at reduced hours. After Labor Day, Agriplex will be operating from Thursday through Monday and closed Tuesdays and Wednesdays. The hours of operation will be 11 a.m. to 6 p.m. Caradoc Community Center will operate Tuesday to Saturday with hours from 9 to 3. Again, we will reassess the hours of our mass vaccination clinics if the policies around who needs to get vaccinated change. But for this time, we're making sure that those resources are available to support mobile clinics and mobile clinics going into schools this fall as well.
Terrific. Thank you very much. And Sarah did have a second question, but it was answered by Acting Mayor Morgan in his opening remarks. So we will move on to the next question. This one is from Daryl Newcomb at CTV News. Dr. Summers, are you considering Section 22 orders to address the rising number of cases linked to nightclubs and sports teams?
Thanks for that question, Daryl. We're certainly monitoring this very closely. We've also been made sure that the province is aware of where we are seeing outbreaks, which includes nightclubs, sports teams, etc. We'll monitor that data very closely. We have, of course, utilized class Section 22 orders in the past. It's never our first choice, and we'll be working with that sector as we have been to look at other preventive ways to try and ensure that the services can remain as operational as possible. However, one of the things that I think has to be on the table, and I know provincial discussions continue to happen around this, these places will be safer if everybody who's there, staff and patrons, are vaccinated. Ensuring vaccination status to participate in in-person activities is one way to ensure that these places can operate, and I would encourage businesses in our region to explore whether or not that's an option for them.
Thank you very much, Dr. Summers. Let's move on to another question from Jacqueline LaBelle at Global News Radio, 980 CFPL. We have talked about the primary and secondary cases now associated with the outbreaks at Delilah's and Lost Love. Actually, you mentioned the primary cases. Jacqueline would still like to know if we have any information on secondary cases associated with those outbreaks.
Thanks for that question. At this time, we don't have any additional secondary cases identified at those outbreaks.
All right, and this will be the time when I'll mention that we are winding down in our questions. If you do have a question you have not yet asked, please do so. Just click on the text bubble with the question mark, indicating your name, your media outlet, and who your question is for. So fair warning, here we go. Maya Reed from MyFM in Strathroy is joining us this afternoon. Dr. Summers, she asks, do you think there will be a rise in cases as the school year starts with students back in the classroom? And what recommendations do you have for parents to remind their kids about COVID safety and protocols?
As we return to the classroom, I am sure that we will see cases identified among students in the classroom. Of that, I have no doubt. However, we've also seen cases throughout the summer outside of school, so I want to highlight that it is something to be expected. However, we also know that getting back to the classroom is a priority for parents and for all of us. Kids have been out of school for too long. In order to make sure that the school is as safe as possible, we're continuing to work with the school boards around masking policies, making sure that active screening is happening for symptoms before kids go to school, making sure that we've got robust and rapid case and outbreak responses, making sure that anybody who's eligible to be in school is vaccinated, or eligible to be vaccinated is eligible, And we're also trying to work with the school boards around what other activities in school may need to be modified to ensure that the classrooms remain the priority and open for kids and for parents. As I mentioned, if you're eligible to get vaccinated, get vaccinated. If you're not, that's okay. I think your vaccine will be around the corner someday soon, but just not quite yet. But in the meantime, wear your mask. If you're sick, stay at home, and make sure that the adults in your life are vaccinated too. It's absolutely critical. I cannot highlight more the importance of the vaccine for those that are eligible. If everybody in our population, if everybody in our community over the age of 12 was vaccinated, we'd actually have enough herd immunity to make sure that those under 12 were protected. Unfortunately, we're not quite there yet. So that means that we do have to talk about other safety protocols. But I still think that we will be able to return to school in September. We're monitoring that very closely. I know the province is as well. And we'll be working with the school boards and others to make sure that we can have kids back in the classroom this September.
Thank you very much, Dr. Summers. And that does bring us to the end of our questions for this afternoon's virtual media briefing. I'd like to thank you for joining us. Thank you for your questions. And of course, Acting Mayor Morgan, Dr. Dukelow, Dr. Summers, thank you for your information and your insights as well as we continue to navigate this COVID-19 pandemic. That will do it for us for this afternoon. We will be back with our next virtual media briefing this coming Thursday. And we hope that you will join us then at 2 o'clock. So between now and Thursday afternoon, have a great rest of your Monday. Take care, and so long for now.